Thanks for this warm welcome. And I think the program looks fantastic, so no comments on that. Beautiful. So yeah, it's nice to be here in Aarau in Switzerland. I was thinking to give a similar talk than I did at ICPR in Haarlem, but then I thought that I'm actually standing in front of people that are based in Switzerland, so what could I even talk about? That's something new, so I try to also contextualize our situation here in Switzerland a little bit, within the broader global context at the moment. So, yeah, we already saw the Matterhorn in the ALPS before. I bring it again. So, Psychedelic-Assisted Therapy in Practice with landscape, and I added in context. So, some disclosures, grants I got, and I was advising a few times. That's it. So, as I said, first opening up the topic, where are we standing at the moment? I would like to also give an intro on pathways to access, then dive into the Swiss context, historical background, then actually talking about the limited medical use that we're having the possibility to work with here in Switzerland. PAT in practice, how does it look like a little bit? Then I think time-wise we won't have much time to go into the training, but that's an add-on if we're very fast, and then a little bit of outlook. So pathways to access. Generally speaking, as far as I understand the whole situation, we have three pathways to access. One is the legalization or decriminalization. Examples are, for example, decriminalization of psychedelics like it is in Portugal. And then we have the religious or spiritual use pathway. For example, indigenous tribes can legally use their sacred medicine, ayahuasca, in the Amazon, or also in Brazil, some churches that use ayahuasca are legal. And then we have the third pathway, medicalization. And there we have ongoing drug development clinical trials, as you're all aware of. And there are some alternative frameworks. And there are three examples I can think of. One is Canada, Australia, and then the third, Switzerland. I'm curious to hear if there are further options, maybe later in the discussion. So this talk will really focus on the medicalization aspect, and I'm going to start with the ongoing clinical trial developments and so on before diving into the alternative frameworks. So this is a graph from the Psychedelic Alpha, which is really worth checking here and there. They list clinical trials, preclinical, phase 1, 2, 3, and approval for different substances, very interesting. And when you dive a little bit closer, you see that Spravato is already approved. Then we have Compass, psilocybin on the way in phase 3. And at that time, they put Lykos, MDMA for PTSD, at the border of phase 3 to approval. And we know that the FDA, we know about their decision. So it's back to phase 3 again. But let's have a look a little bit. So MAPS was founded in 1986, just 1 year after the CEPT was founded. The history of MAPS is very interesting, worth looking at it on their website, for example. So in 2017, the FDA granted breakthrough therapy designation. And then already in the next year, 2018, the phase 3 clinical trial, MDMA for PTSD, started in the ongoing years. And maybe 2021 was like a hype peak year. I'm curious to hear your perspective. Are we post-hype, pre-hype, in the hype? I don't know. But these were the headlines at the time, like psychedelic revolution is coming, psychiatry might never be the same again. I guess most of us in the room doubt this, but this was the atmosphere at that time. And then this summer, there was this famous FDA advisory board meeting, and they advised the FDA not to approve MDMA at the current state. And FDA took that advice and did not approve MDMA Lycos at the moment. And there was a lot of critique, or there were certain points that they criticized, and I guess it's worth looking into that. I mean, they have a point there. So they criticized the evidence of effectiveness, and then a very huge topic in all psychedelic trials, the functional unblinding. They also said that sponsor and investigators were biased. They raised questions regarding the psychological intervention in the protocol, and they asked or wondered how the regulation of the psychotherapeutic or the framework would look like once MDMA is approved. And there were some therapist misconduct issues important, so they require more data. Yeah, and what we know from other substances is that over the years, or the more clinical trials, the longer a substance is in the field being investigated, the smaller effect sizes become. This is also due to statistical reasons. And the bigger the sample size of studies, usually the smaller the effect size. So I think it's worth looking at these methodological things and like also putting psychedelics into a larger context also in that sense. I said that already. Then there are some concerns, or I would like to also maybe show a little bit or give some insights into the actual current discussions regarding these points that were critiqued. So, like, for example, there's might be underestimation of effectiveness of these trials. We saw the last year, or it was not last year, it was 3 years ago, the psilocybin compared to escitalopram study for depression from Imperial College, and they showed improvements, but in both groups, so the difference between the two groups was not significant. However, there are some issues regarding efficacy and effectiveness, and there are many people in the field writing about it. I would like to just point out one just recent preprint from Eduardo. It's worth diving into the topic if you're interested. And then just recently, last month, there was this great presentation, publication, which David Ariso also mentioned. Sorry for repeating your your actual topic, but I think it's a very valuable contribution to see that the psilocybin group maybe didn't outperform on the primary outcomes like depressive symptoms, but on many secondary measures like well-being, meaning of life, social impairments and things. So I guess it's also time to rethink secondary outcomes and what are we actually measuring and what is like the perspective of the patients and their life. Then there are other discussions in the field. One is like if the subjective experience does even matter. So there are papers questioning this, and we heard about non-subjective psychedelics that don't have like psychedelic effects. But then there are also other papers saying, well, but the subjective experience might actually be important. So this is another discussion going on at the moment. Another important discussion is if it's the drug or the psychotherapy. And Goodwin asked if it's actually necessary that psilocybin assists the psychotherapy, or if it's maybe just the psilocybin. And there I would like to bring in the concept of evidence-based medicine, which, research evidence is one very important part of it, like the data, the clinical trials. I was very interested in the ketamine trial that showed some improvements with psychotherapy. I think that's absolutely needed, so looking into that from a more like scientific perspective. But evidence-based medicine also contains has two other pillars, which is clinical experience and expertise, and patient preference, which is also very important because it's the patients that we are treating. So I think it's a very great development that more and more we have these publications also on patient perspectives and clinical expertise complementing the whole picture. Why is it so difficult to do these studies with psychedelics or with psychedelic-assisted psychotherapy? I think partly it's because it's a combination of a substance, molecule, which can maybe be considered within a biomedical paradigm. It's a molecule. But then we also have phenomenology, like an experience, a subjective experience, and we have the psychotherapy. And there, other models might be better to explain what's going on. And from psychotherapy research, we know these common factors of psychotherapy, and psychedelics have been proposed to enhance or amplify general experience, but potentially also these common factors of psychotherapy. Just recently we published an opinion article raising some of these questions and also suggesting that we should combine and integrate all that knowledge that's already there instead of trying to invent everything new. So where are we? We are, the alternative frameworks. I found it very funny to read newspaper headlines in Switzerland when Australia was apparently, according to the Tagesanzeiger, the first country to make medicalized MDMA and psilocybin possible. Because that's, at least as far as I know, not the case. We have Switzerland also being involved in that since a few years already. So let's get to the actual topic, Switzerland. So also here a little bit of background, again, diving into the history very briefly. Maybe some of you know this publication from Michael Kometer and Franz Vollenweider. I like this graph. I often take it to kind of give a first overview of the history. And in red, you see 1938. We already heard today morning very nicely the synthesis of LSD by Albert Hofmann. And we also know the bicycle day when the subjective effects were discovered in 1943. Often in the history, not only of psychedelics, but also of psychedelics, we forget all the great women that were involved. So the lab assistant of Albert Hofmann, Susi Rammstein, she was very young, 21 or 22, so very courageous to also step into that field, and she had her first experience with LSD, and this day was then called the Drum Day. So I think it's nice to also, to acknowledge that. And in the similar way, you see a picture from the Novartis archive with a woman with she's doing the pistol inoculation of an ear of rye, and she doesn't even have a name, which is sad. But many women were involved in the history. Then there was a first study, LSD study in humans by Stoll at the Burghölzli, nowadays the Psychiatric University Hospital of Zurich. And then Albert Hofmann also isolated and synthesized psilocybin, and here we can not only make a connection to the women involved, but also to the ancient traditions, because he got the spores from Valentina and Gordon Wasson, who went to Mexico and visited Huautla de Jimenez. It's a small country, a small village in the Oaxacan mountains, very nice if you have the chance to travel there. And they participated in rituals with Maria Sabina. So also very interesting and a bit complicated story if you're interested in looking more into that. Then there was the war on drug, and some of the substances, or most psychedelics, were prohibited. Switzerland was a little bit slower, a little bit hesitant to follow this international groove, but also in 1975, a few years later, these were also, like the psychedelics were also prohibited in Switzerland. Maybe something funny that in the 1990s, psilocybin mushrooms were placed from the Food Regulation to the Narcotics Act. I find these historical facts just very interesting to contextualize. If you're interested in these topics, read these books, very, very great to read them. In Switzerland, if we look at the history of psychedelic-assisted therapy a bit more closely, as I said, 1985, the Swiss Association of Psychedelic Therapy was founded, and there was a time when some of the founding members had permission to work with these substances, and many with LSD and MDMA, and many patients have been treated during that time, and also a training took place at that time. Then 2006, the 100th birthday of Albert Hofmann, which was a huge event and also caught international attention. And then there was this one study from MAPS, MDMA, by Peter Oehn and Verena Wittmer, led by them. So I think also very important to look at the international connections. So Switzerland, very small, but still somehow important for the international psychedelic research. And the first LSD anxiety study led by Peter Gasser. Now a little bit more recently, the last 10 years, we already heard 26th of September was the first approval that was given by the Federal Office of Public Health to Peter Gasser to work with LSD in the framework of limited medical use, which legally was already a possibility before, so the law didn't change, but it was only then that it was put into practice. Then, almost 10 years ago, there was another anniversary, 30 years of SEPT, which was again a nice conference with international speakers and guests, and followed by a second LSD study. And since 2018, therapist training groups are going on again in the SEPT. And last year, 2 new associations in the French-speaking part of Switzerland were founded. I think it's very good what's happening, like with the interconnectedness and also looking at collaborations. I forgot to mention the Ticino Foundation, Alaya, which was also found. I'm sorry for that. And the associations came together to found an interest group to kind of bundle the resources in issues that are relevant to all the associations. And nowadays we have psychedelic research groups in several universities in Switzerland. Now about the limited medical use. Yeah, so to understand the legal framework, there's this exception article in the Narcotics Act that substances of the highest prohibition level can be used in certain cases with exceptional permits from the Federal Office of Public Health, in serious illnesses when a lot of things have been tried out and nothing really worked. So it's really exceptional permits and case-by-case permits. I think that's important to understand. And currently MDMA and LSD and psilocybin are used in this framework. Medical doctors can apply in that framework, and each exemption permit is for an individual patient and for 1 year. So as I said, these are not primary or first choice treatments, but exceptional treatment options. Last year or beginning of the year, we published this article with some numbers. I was happy to receive some updates for ICPR, so we have a little bit of an update here, numbers until April this year. And you see that the first years, not so much was happening, some individual cases, but over the last few years, really an increasing number of patients that are being treated. So we're experiencing media interest and a lot of patients being interested in the treatment options available with psychedelics, and also more and more colleagues joining. A little bit about treatment modalities maybe. So it can be said that medical doctors who apply for these substances and get the permissions are meant to have the knowledge how to use it. So it's kind of the responsibility of that physician to how to apply. Of course, he needs to state an indication. So the whole application needs to clarify why the physician thinks or that this could benefit for the patient. And this is also based on evidence. So we cannot just ask for whatever, but we need to also cite research, publications, and so mostly the permissions are given for depression and anxiety, but in legitimate cases also some exceptions can be made for other indications, even also somatic or neurological. So in Switzerland there's, I'd say, a lot of experience and also a lot of implicit knowledge. That's an interesting situation. Federico, in his opening talk, already showed this very nice transdiagnostic model. I think it's also interesting to look at this transdiagnostic understanding when we treat patients. I mean, it's something that we clinicians know, but still from the drug development perspective, we have this diagnosis specificity, which we might at some point also overthink. And there's, as I said, this kind of psychotherapeutic flexibility, and also like the involvement of other professions like us psychotherapists, psychologists, or nurses is also the responsibility of the physician applying for this exception. I wrote with question mark limited experience, so I think we have many elders that have a lot of experience, but we youngsters, we enter the field, and of course we start with limited experience. And it's also a learning by doing and many unanswered practical questions. So I guess one very important thing is what we are doing here, network, coming together, learning from each other, exchanging, having conferences. So I really appreciate ALPS for setting up the conference, a lot of huge work behind that. Yeah, and unfortunately we don't have that much data because it's limited medical use and not studies, so we have been a little bit criticized maybe by the international community. Jasmin Schmid from the University of Basel is giving her best to accompany the treatments like a quality control. And she has also published about it, so I think it's great, but yeah, we don't have that much data. We wrote about the situation in a German article. I Google translated it with to English. I'm not sure how the quality is, but it looks rather great. So you can try out Google Translate PDF. In practice, how does it look like? Maybe again, some historical background. SEPT has this psycholytic in its name, but we always talk about psychedelics, so where does this even come from? Historically, when we look back in Europe, the approach was more having small doses, many sessions, sometimes I heard even weekly sessions. Leuner apparently used very small, very often. And the idea is rather psychoanalytically oriented. So in Europe at that time, psychoanalysis was like very prominent, and the model behind this is like to maybe work with biographical stuff, to loosen defenses, work with transference, and increase these regressive states, insights and understanding, maybe a reduction of tensions and so on. So we could say maybe like an adaptation process. And on the other hand, the more North American approach historically, like Groff and Panke, more high doses. Sometimes I read like up to 600 or 800 mics of LSD, that's quite a dose. And like 1 dose or 2 doses, extreme experience, fundamental change of consciousness, existential topics, awe and wonder and mystical type of experience, birth and death. So these very existential topics, maybe with a framework of rather not adaptation, but transformation. So that's historical, but I think nowadays we have maybe a mix. It's kind of also transient, so in one session both can happen, like biographical experiences or also mystical type experiences, or like I think nowadays we don't differentiate that much anymore. But still, when you look at the publications, you can still see some differences. So these Johns Hopkins publications with mystical type experiences, you can read them, while in Zurich we have Rainer Krenmann talking or writing more about secondary and primary process cognition. So it's still a little bit visible. Yeah. In practice, the understanding that we have, at least nowadays in Switzerland, in that model is still based on an emphasis on the psychotherapeutic process. So we don't have a psychedelic treatment, but a psychedelic-assisted treatment. That means that people are in an ongoing psychotherapeutic process mostly. There's a foundation, maybe you have a therapeutic relationship already, screening and indication. Then this process might go into a preparatory phase once the physician and the patient decided that psychedelics might be an option. And a psychedelic experience is taking place during that process on one day, and the integration phase, that's in the understanding of psychotherapy also, I think, a very interesting word, because of course we know integration is very important and we talk about it, and it is. And still, if we think in a psychotherapeutic process, it's also not something that different than what we do anyways in psychotherapy, because we're integrating what we experience all the time, every day. So I like to think psychedelic-assisted therapy as a process. But of course, there are more and more models trying out also more separated options. So I think it's a very interesting conversation at the moment. And do we need the psychotherapy or not? Or which patient need how much of what? So, like one example, how we work in the group practice is that we have groups between 4 to 12 patients. We are 2 to 3 therapists. We have all of them have like ongoing psychotherapy, and within the group we have 2 sessions in advance and 1 psychedelic session and 2 sessions as a group after the psychedelic session, and this repeats all the time. So we have these cycles of 3 months, and patients can continue, and at some point they maybe leave the group and someone else starts. And we work with mixed groups. We had groups with all substances, and it works surprisingly well. I was more maybe skeptical in the beginning. When we talk about psychedelic-assisted therapy, we talk about set and setting, of course. Some setting variables that are maybe relevant for the Swiss landscape at the moment is that we have individual and group settings, we have inpatient and outpatient, we have PAT in practice or in the clinic. All these questions, how to prepare the room, what is the atmosphere of the room, also the music or instruments, also who are the therapists and their attitudes, the location, is there a possibility of overnight stay, all these questions arise. So I think we're experimenting, and we have people with a lot of experience, but also younger generations also adapting to the circumstances and trying out what works now and today. Some of the challenges that I maybe have already addressed a little bit. So yes, PAT in our situation is limited medical use and not a standard treatment. That is a graphic thing. So we have many patients and relatively little therapeutic expertise. This has implications also for training. Do we address many therapists to increase the quantity of therapists knowing about it, or do we focus more on quality and long education programs with smaller groups? I think that's a tension and difficult. And in practice, the question of if psychedelic personal experience is needed or not, also a topic that's being discussed internationally. And yeah, from a very small niche with a handful of therapists to increasing numbers, of course, this also brings with it some challenges. So we have expertise and implicit knowledge and just therapeutic flexibility, and how much do we need standardization and certifications with the increasing numbers of therapists involved. Practical challenges or questions, formalities, application, also reimbursement, a huge topic, I think, not only for us in Switzerland, how to get the substances. I mean, we have easy routes here, but it's a topic. And psychotherapy in itself, I consider sometimes a challenge. So how do you decide for the indication or contraindication beyond the categorical diagnosis? The setting, also difficult experiences or emergencies, so where's the fine line and how to deal with them. Some ethical issues such as informed consent, so how can you be informed about something that is beyond imagination of everything that you have ever experienced before. There are full panels on that at conferences, and I think it's super relevant and interesting. Also the ethics of touch and non-touch, also debated. Psychotherapy as a process and as a challenge itself, and expectations from the patients and also from the therapists. And I guess the more we work in that field, the more realistic our expectations become, and I think that's good. We know that psychedelics have a potential and they are not miracle cures. So, I don't know. We can maybe jump over or shortly address it. Education or training in PAT, I think that's just like how it looks like in my head. I think on the foundation, it's whatever our individual foundation is: medicine, psychology, nursing, social work, whatever. And then it's learning by doing, it's connecting and exchange, what we're doing here. It's supervision, peer review. I learn a lot by gathering with colleagues and talking about our difficult situations. And for that, I really appreciate that we have foundations of trust where I can jump in and say, hey, I feel I fucked up. What should I do? How do you see it? So I think this network of practitioners is super helpful. And learning from the elders by taking supervision. So, and then based on that, there might be pillars such as further education programs, training, seminars, lectures, there are courses, workshops, conferences like this, and I don't know which other thoughts and ideas you have. And I would say now that we don't have a certification process yet, it's valuable that we document what we are doing, and just whoever, we don't know how the future will look like. And also to understand that it's an ongoing process. One example is the SEP training group, which is more on the side of the very little small groups and not so much quantity. So, it's a difficult dilemma, but this training group at the moment looks like this. We have the 24 trainees per group, medical doctors and psychologists, and the program is based on practical workshops and theory days and ongoing intervision and supervision. And at each retreat there are trainers and experienced elders involved. And we have theory days that are also open to the wider public, because we think that it's one option how we can foster exchange and networking. And address the need for training also. We wrote a little bit about that as well. Now, I talked about the networking and exchange. So already Luborsky in 1985, actually the year when the SEPT was founded, I didn't realize before, he said that the therapist matters. And I think in psychedelic-assisted therapy, it's interesting because it matters a lot and it doesn't matter at the same time. So it's a very interesting situation. And regarding this question, if personal experience is important or necessary or not important or not necessary, we thought we'd set up a study and ask the trainees themselves. And it's an open label study where the trainees can have up to 6 personal psychedelic experiences. It's open label, so they know what they're taking. Of course, methodologically not so good, but as a first step, at least to get an insight what the trainees tell us. And we have qualitative interviews and psychometric assessments to ask them, from your perspective as a trainee, was it valuable? Was it challenging? What are the risks? What are the benefits? So we want to know from them. Outlook. So I was contacted by someone, Devin Atherton from California, and she wrote, over the last 4 years, the California legislative body has stalled or rejected multiple bills requesting PAT authorization, citing insufficient treatment recommendations as the principal grounds for the bill's dismissals. And there's one of these letters from the Office of the Governor of California, and in there, he writes, both peer-reviewed science and powerful personal anecdotes lead me to support new opportunities to address mental health through psychedelic medicines like those addressed in this bill. And he writes further, California should immediately begin work to set up regulated treatment guidelines, replete with dosing information, therapeutic guidelines, rules to prevent against exploitation during guided treatments, and medical clearance of no underlying psychosis. Unfortunately, this bill will decriminalize possession prior to these guidelines going into place, and I cannot sign it. Very interesting. So, we heard that Australia last year was the first to make that possible. But if we look at this big map, there's a small country colored in red, which you might not even see it because it's so small. But we have that. We have this experience. Yesterday night, I was on LinkedIn, and I found, again, the Matterhorn, very funny. So the Matterhorn is a symbol these days. In psychedelics as well, not only for Switzerland. And they wrote 10 years of advancing psychedelic-assisted therapy, Switzerland, and its pioneering guidelines. So I found that yesterday evening, which was funny, and they're referring to the treatment recommendations that we, together with all these associations, as Federico already mentioned, published. It feels a bit uncomfortable that it's only the two of us here, like Peter and I, because it was really a group project and everyone involved contributed. So I think it really represents the knowledge of the practitioners in the field. So maybe in a nutshell, there are different pathways to access. Psychedelics also challenge a little bit the biomedical paradigm and also the gold standard of drug development. That's why we have so many discussions. And there's this limited medical use in Switzerland going on since now already more than 10 years. Compared to clinical trials, of course, we have more greater psychotherapeutic flexibility, less standardization. There's a lot of expertise and implicit knowledge, and also learning by doing, consequently. And therefore, also, there's this importance of connecting, exchange, continuing education, and so on, which we're doing right now. And no solo attempts is also something that is important in this field, and an open feedback culture. And something regarding ethics, I think in psychotherapy we have ethical principles, and they are equally valid. And maybe because of the specificities of PAT, there are some additional issues that should be raised. Well, I ask if there is something to learn from the Swiss situation for the global situation. And I wonder what's next. And thank you.
Thank you for the great talk, Helena, and the overview over psychedelic-assisted therapy in Switzerland and beyond, as well as the very thought-stimulating debates that are currently, the questions that are debated in the field at the moment. So you were perfectly on time, so we have about 15 minutes of questions, and as always there will be volunteers with microphones, so you just raise your hands and so we'll come to you.
Thank you very much for your talk. For the medical access to PAP, I have patients that don't want to take SSRIs or other medications. They've tried St. John's wort, Hypericum perforatum, and Griffonia simplicifolia and other plants with not an efficient therapeutic result. And they'd like to go directly to either psilocybin or LSD, preferring psilocybin because it's closer to a plant in their eyes. And I can't, because to get a green light from the Federal Office of Health, you have to have tried 2 or 3 different SSRIs or other heavy medications, and the patients don't want those side effects. Is that something that in the future we would be able to have as a first indication after it gets accredited to be used by the FDA or Swissmedic?
Yeah, so according to the law, it's an exceptional treatment option, and there are some requirements to get such an authorization. What I would try to do is really write to the Federal Office of Public Health the exact reasons why SSRI haven't been tried before. You might find ways to explain them the reason. I think I would just try it out. I mean, it's not defined that it needs 2 SSRI treatments, or so this is not like exactly defined. I don't know how they decide what they decide, but I would just write why you want to do that and give enough information about the patient and about the substance and the indication that you want to use it for.
Thank you.
Hello. Thank you very much for your presentation. Patients with a history of psychotic disorders are usually excluded from compassionate use programs as a precaution. And yet, from what I know, it's still unclear whether psychedelics can provoke the onset of psychosis or a relapse. And so I was wondering if you had any clinical experience with psychedelics and psychosis.
Yeah, delicate question. I think we're at the moment rather on the try not to do mistakes, because it would maybe also harm the whole thing. I think there are clinics that try with negative symptoms of psychosis. If patients don't have positive symptoms, also we had patients with bipolar 1, which, like, this is something I have experience with, which bipolar 2, which others have excluded. So I think it's good to be cautious and have the patient in mind and the risks and benefits, and also the larger community. But yes, I think we still know very little in terms of all these questions. But good question.
Thank you for your talk. It's really great to see all this research and the experience you've been building. I would like to know, it seems like you think this is very useful. So what is your take on making it more widely accessible? Why is the Swiss government not making it legal for more people to take it? What is your position on this? Do you advocate for them to do that or not? And can you speak more to that?
I think legalization is like a path that I'm not against, but I'm not too into the topic. I think there are good reasons against legalization and good reasons for legalization. I find myself more in the medical pillar of the access, so there are experts on the other on legalization and decriminalization. I think decriminalization makes sense because the illegal status of the drugs just cause a lot of problems and suffering. I guess based on the current legal situation, this is what can be done. I don't know how they will react with more and more applications. I mean, we had a similar situation with cannabis. It was also case by case, exceptional permits, and it just increased by numbers. So at some point, I don't know. I mean, I can't really answer that question, how this will be received by the authorities. And I think also that Switzerland is not in the EU, but it's dependent, also bound by bilateral contracts and so on. So I think also in the Netherlands there were discussions even after the FDA rejected MDMA that they were very supportive of implementing MDMA, but also considering the legal status. So I mean, we have a law and we're bound to this law basically. So legalization would be a path of changing the law, and I think that's quite complicated because it also involves international contracts, not only national issues.
Hi, thank you very much for your presentation. I just wanted to ask if we could touch upon the topic of group therapy, if there is any experience in that regard, both in the sense of integration with people who have undergone individual therapy, but also group therapy, like with dosing in a group. What your thoughts are about that, and if you see it going in any specific direction.
Yeah, good question. I think there are very experienced people in the room with group therapy for years and years and years, and two of them have written a paper, which are the two Peters, Gasser and Oehn. So you can write that. It's really from their experience. I think it's valuable. And also Paulina wrote a more theoretical article about it, which I also appreciate a lot. So taking into account Yalom's group therapy factors. For me, I really like groups. I think it's what they say is that they are not alone. They share their experience. They also, I mean, it can also cause irritations. It's also a beautiful way for projections and transferences and to really work with what's happening also on a group level. But of course it needs a container and an understanding also of group dynamics, because you have the individual process and you have a group process. I think for the future it's a good model also because of economic reasons. But it's certainly not the first reason why I like groups. I guess also, or I know that for some patients it's also too much to be in a group. I mean, we also had autistic patients, or if the social anxiety is very strong at the beginning, I mean, you have to figure out with every patient what works. But I think, read the papers from the two Peters and from Paulina. There you find a lot of valuable perspectives on that.
We have time for 2 more questions.
Thank you. I was wondering, we've heard that MDMA, for example, is used, or looks promising in treatment of PTSD, and in regards to psilocybin and LSD, which, as far as I know, are pretty similar in their mechanics and overall experience, they or what is on what basis do you decide which substance you use for which problem? Is there a general rule of thumb you follow, or is this an individual decision?
It's an individual decision somehow, yes. I mean, also in communication with the patient. Many come nowadays, they know they want psilocybin because they read about it. And then you can maybe get into a communication if that makes sense or not. I think MDMA is generally underrated because I think some people think that it's kind of a beginner therapy substance, but I've seen it being very valuable also for patients that have had psilocybin before. So I think there's really a benefit in MDMA in itself, not only as a beginner substance, maybe for patients that have an issue with a connection to themselves or heart opening, isolation. And MDMA, psilocybin and LSD have maybe some more power to disrupt structures and kind of, you know what I mean? Yeah, but you have to find it out. People react also very differently. An MDMA experience in a therapeutic setting can also be very, very challenging. It can be super boring. It can be, So people that have had MDMA in recreational settings, I've experienced that they were very surprised by the effects they had in therapeutic setting, because it was not only heart opening and nice, but maybe also very challenging or boring, or I mean, whatever. So, difficult.
Okay, thank you.
Yeah.
Yes, thanks for the nice overview. I was struck by the lack of research on the efficacy of this access of medical use of psychedelics. And I wondered, do the federal authorities have placed a monitoring system in place to evaluate at a certain point if they should continue or discontinue this program, out of curiosity?
Yeah, so you write an application to get the permission, and after that year of that you had the permission, you have to write a report to the Federal Office of Public Health. So yes, they have an overview, but it's not that much systematized. So Jasmin Schmid is really trying and doing her best. She also published about it. I can send you the publication, which already gives some insights, and this quality, like the actual content of the questions has changed now also to make it more accessible, more easy to fill out, and so she hopes also to get more feedback by that. So it's not very systematic, but of course the authorities get feedback on an individual case, and Jasmin Schmid is collecting data and hopefully publishing here and there, yes.
Thank you. Let's give another round of applause for Dr. Aicher.